Welcome back. Our next guest, Dara Woods, was diagnosed with a rare disorder after she suffered constant and severe nosebleeds, which required many blood transfusions. HHT is a genetic condition that also affects Dara's daughter and has tragically claimed the life of her son, Paul.
We also have consultant radiologist Adrian Brady from the National HHT Centre at the Mercy University Hospital here in Cork. Guys, you're very, very welcome to the show.
Very welcome.
Adrian, if I can start with you, what exactly is HHT?
Okay. Its full title is hereditary hemorrhagic telangiectasia. HHT is obviously much easier for people to say. It's an inherited condition, so if you have it, each of your children has a 50-50 chance of inheriting it. The fundamental abnormality is an abnormality of how blood vessels are formed. So if you have it, you will form abnormal vessels in certain body parts. So people typically would have nosebleeds. They would have a particular type of spots on their hands, their face, their mouths, and that's what people who have the condition are often aware of. But the same abnormalities can occur in blood vessels in deeper systems that patients are unaware of.
We're taking a look here. It's almost like there's a blood coagulated under the skin. And is it that the blood vessels cannot hold the blood or release the blood, or is that the basis of it?
No, what you're seeing there actually are abnormally dilated blood vessels. It's the vessel itself and the blood flowing within it that you're seeing. And that's the fundamental abnormality, that instead of having vessels that get tinier and tinier as you go down the tissue spectrum,
they get larger.
They get larger. You get big vessels where you shouldn't have big vessels.
Okay.
How did you discover it, Dara?
I grew up in a family of nosebleeders. It was our normal. My father nosebled, 4 out of 5 siblings nosebled, so it was normal to us. We didn't think there was anything wrong with it. And I moved to Dublin. I'm from Donegal, but I moved to Dublin and I settled down and got married, and I suffered nosebleeds all through my working life.
And you didn't take any notice of it?
Not a bit. I stuffed a tissue up my nose and got on with it.
Yeah.
And really, it wasn't until I had 2 difficult pregnancies with extra blood being pumped through your system. Your blood vessels are so fragile.
And did you have those little things in your hands, those dots in your hands?
Oh, my hands. I have them in my nose and my gastrointestinal system, my GI tract. So
they can be in different parts.
They can be in your lungs, your brain, your liver, your spleen, wherever you have fragile blood vessels.
And because you were losing blood all the time, did you feel weak or off? Because
I was brought into hospital many times and got blood transfusions, and a lot of us depend on blood transfusions.
But did the doctor not cop something was wrong then?
They don't know. They still don't know. A lot of them still don't know about HHT. They really, really don't. They tell you you're low on iron, maybe a little iron tablet here or there will help you. But because for so many people, nosebleeds are normal. They maybe after a head cold or maybe after a kick of football.
Yeah,
but ours were different.
As a kid as well, you know, it depends on the severity, I suppose, of nosebleeds. You know, children can... I remember I suffered with nosebleeds, and then I remember going and having a procedure to, I don't know what they did. Yes, cauterized.
But they were healthy nosebleeds in one way. Ours are unexplained nosebleeds.
And continuous and unexplained,
Totally. In your sleep at night, you wake up in the middle of the night and you'd be saturated.
My God.
Oh my goodness, that is so scary.
I have no idea.
So when you were pregnant then, obviously you had no idea about this. You had no idea that it may manifest itself in your children as well.
No. I was bedridden for the 2 pregnancies. I wasn't out anywhere. The doctor would come and inject me with iron, and that was all they could do. Once or twice I ended up in the eye and ear during my pregnancy, and when they took a look at me then, they sent me straight into Holles Street, and I was there to the end of my pregnancy.
Adrian said there that you have a 50-50 chance of passing it on to your children. Now, both Katie and Paul.
And Paul, both of them had it. It wasn't until about 2012 when we were introduced to Adrian and the centre down in Cork that we went down, and Adrian's team had us in. And this is the importance of getting down to this centre, because you're screened, your brain, your lungs, your everything is screened. So we know I had the unfortunate sign of nosebleeds, and nosebleeds are the visible external sign. But Paul and Katie had the nosebleeds as well, and we knew there was something just not right. So we got down there. We had genetic blood testing, and it confirmed they had the gene.
Is there anything you could have done at that stage then, Adrian?
Well, we did, and I want to take the focus a little bit away from nosebleeds, because while they're what most patients are aware of, the dangerous things are actually the deeper abnormal vessels in organs that you don't know are affected. And it's not so much, it can be bleeding, but if you have abnormal vessels in the lungs, for example, you're at increased risk of stroke, you're at increased risk of brain abscess. if you have abnormal vessels in the brain, you're at increased risk of stroke or brain hemorrhage. And they're the kind of things we actually are most interested in picking up because we can do something about those. We can eliminate those abnormal vessels once we've identified them. And that's really the focus of what we try to do in the Mercy.
Yeah, eliminate them and treat them. What about Paul then? Tell us what happened.
Paul was 22 in June 2012, and Paul had just done his finals in environmental science in DCU and was heading to Paris. He loved Paris. He was heading to Paris with his lovely girlfriend, and they got there 5 days. And Paul one evening, the two of them were reading books, and Paul one evening just keeled over. No signs of anything that day. They had 5 good days in Paris, and he just keeled over on poor Karen. And we got a call. I was in Galway with Paul's mother and his godmother, who's looking in today, Rose from Derry, and we were having a wonderful day in Galway, and we got the call to say that Paul really isn't well. Karen was saying Paul's not well, and the paramedics were there. It turned out Paul died instantly. The vessels in his lungs just ruptured. And again, HHT, they didn't know too much about HHT.
At the time,
So
That's it's very
so
extreme.
we sat down and just said, we have got to do something. We've got to know more about it. We've got to learn about this.
Yeah.
It's a rare disease, but we've got to take ownership of it.
Especially with your daughter then, you're thinking of that, obviously.
We can't expect the guys in A&E or even the GP to know
To
about
deal with
our
all
rare
this.
Do you know what they're
disease.
dealing with?
No, they haven't a clue. So we set up our patient organisation, HHT Ireland, so people can come forward or hear about it some way. We're trying to get the word out and get them in to see Dr. Adrian.
you have a Valentine's campaign as well coming up.
We do indeed. It's our way of saying thank you to the blood bank because we depend on blood so much. So from today, Monday the 12th, until Friday, we're asking people to go in, make an appointment, donate blood and hold up our banner. They'll find it on our Facebook page, HHT Ireland, and take it in with you and just have a selfie taken and put it up on social media and explain to
And get
people
the
what
word
you're
out
doing.
there.
I think get the word out there. Is there anything, Adrian, that could have been done for Paul?
It's difficult to know. I mean, people who have HHT, about 10% of them die prematurely or suffer serious disability because of the unknown elements of it. In Paul's instance, we had actually treated abnormal vessels in Paul's lungs some years previously. We were keeping an eye on another small one that was very small, well below the threshold at which we normally treat. Unfortunately, that went bad, as it were. But yes, the whole focus of what we're trying to do is identify people who have dangerous
And that's the positive
manifestations
try.
and deal with
Yeah.
them.
That's
Okay,
what we want
and
to
know
do.
about it. And let us all know about it.
Life
as well.
goes on, as you say. Katie, Paul's sister, is in Barcelona living life healthily, has them in her lungs too, but they're microscopic, and she screened every so many years, and we
And
manage
she's
that.
going down the right path.
and that's the
just about.
message we want to give
we
to
need to do that.
Thanks,
Right,
Sarah.
thank you
Thank you
very
very
much.
much for coming in today. As we said there, hhtireland.org. We had it up on our screen. It's there again now. Go onto our Facebook page as well, RT Today, for more details on this.